Floria Lind works as a nurse in a Swiss hospital. Today she has a night shift after the weekend. Her colleague, B. Schmidt, works in another wing of the hospital. The ward is understaffed, so the medical staff is having a hard time. But Floria handles her work excellently. She is well liked by both colleagues and patients, always ready to help. Many elderly patients require special and constant attention. Despite the fact that such work is not easy, Floria always treats people in need of care with exceptional gentleness. She is cheerful and smiles often. The ward is already packed to capacity, but patients keep coming in. Today Floria is assigned an inexperienced student, Amelie Offshar. The nurse gives her the first task, to remove the bedpans from the dishwasher and prepare the laundry bags. Full of enthusiasm, the girl immediately gets to work. The hardest part of this job is telling patients about poor test results and diagnoses. Most often doctors do this, but sometimes junior medical staff as well. Floria's colleague, Jan Sharif, briefly lists for her how things stand with the patients in the ward. After this, she begins her routine duties, setting up IVs and so on. Suddenly Jan tells her that Herr Osmani will undergo an unscheduled surgery. After assigning new tasks to Amelie, Floria prepares to set up the operating room, but on the way she gets distracted by other small tasks. So Floria asks Amelie to take the patient to the operating room. The staff is critically shorthanded. Frau Osmani is here to support her husband. The man changes into a hospital gown while talking on the phone. The couple has their own business. Frau Osmani explains to the nurse that in their absence their son will take care of everything, and her husband instructs him. Floria politely asks the patient to hurry, he is already expected in the operating room. Because of the delays, Amelie's help is no longer needed. Floria manages everything herself. Frau Osmani accompanies the nurse with the stretcher to the elevator. Then Floria and the anesthesiologist prepare everything necessary. Osmani is about to undergo gallbladder surgery. The nurse assures him that everything will go quickly and smoothly, after which the patient is placed under anesthesia. Since she is no longer needed in the operating room, Floria continues with her other duties, and in the corridor she is approached by an elderly patient named Robert Leu, who has been in the hospital for 6 days already. His doctors keep changing, and no one says anything. Floria asks him to go back to his room and rest, and promises to find out something. The nurse goes to the next patient, Herr Nana, who is suspected of having an intestinal obstruction. The man categorically refuses tube insertion, so the doctors have decided to perform a CT scan. Floria gives the patient the contrast agent. Herr Nana is frightened, as he is here alone, his relatives are in Brooklyn. The woman checks on the next patient, Herr Schneider, who has recently been in a dazed state because of dementia. His daughter takes care of him. Floria understands how difficult this is and expresses sympathy to the woman. Though she is ashamed to admit it, she would prefer for her father to finally let go. Herr Schneider also has a son, but it makes no difference. Usually everything falls on the daughter's shoulders. Because of the contrast fluid, Herr Nana begins to feel nauseous. If he does not drink it, the CT scan will be cancelled. Floria, trying to handle everything at once, draws an antiemetic into the fourth. After the fourth is set, Amelie takes the patient on the stretcher to the procedure room. The more time passes in the shift, the more frantic Floria's pace becomes. At the same time she must keep a great deal of information in her head, so as not to confuse medications and not to forget any of the patients. Floria returns to Herr Schneider's room, where he is experiencing constant pain. His daughter asks for a painkiller injection for him. Robert refuses to eat. Floria promptly checks his blood sugar level and learns that it has dropped. This explains the man's weakness. The nurse asks him to lie down, and after scolding Amelie for forgetting the glucose for the patient, brings him some food. With diabetes, regular meals are essential. Robert worries about his 11-year-old dog in case something happens to him. It is not easy to find a new owner for such an elderly dog. Robert shows Floria photos of his pet, who is currently being looked after by his neighbor, but she keeps complaining. The man worries that the dog will end up in an animal shelter. Floria promises to tell his attending physician and figure something out. Some patients complain that they have to wait so long for a nurse, not understanding that the medical staff is critically insufficient. Floria always reacts to such complaints with restrained politeness. She has too much to do to spend energy on this. But not only patients complain, their relatives do as well. Frau Bilgen's sons do not understand why no one has approached them yet. Floria explains that all the doctors are in surgery, and there are only a few nurses on shift. As soon as the doctors are free, everyone will be seen. Floria is needed everywhere at once, and she tries to manage everything without leaving anyone unattended. Such work demands complete dedication. A woman named Isabel from Boston calls, wanting to speak with her mother, Frau Kuhn. Floria hands the phone to the elderly woman with dementia. Hearing her daughter's voice, she becomes upset and repeats that she wants to go home. Floria is forced to insist that the conversation be ended. Frau Kuhn keeps repeating that she wants to go home to her husband. The nurse starts singing to calm the woman, and it actually works. A patient named Frau Casada is so happy that her cancer test results are negative. Floria shares the woman's joy. Frau Casada does not intend to miss her chance at a new life. Unlike Floria, Amelie has not yet grown used to such a frantic pace of work. Frau Lauber uses the emergency call button so the nurse will come to her room more quickly. It is time to replace the antibiotic solution in her four. Frau Lauber had planned to travel with her husband, but ended up in the hospital. Now with a stoma, she may never swim in the sea again. Frau Lauber has thin veins, and the injection site is inflamed, and Floria is the first nurse who has managed to place her four on the first try. One of the patients, a woman, had already been here last year with a cancer recurrence and remembers Floria. The woman asks how the nurse is doing in her personal life. Floria, with a sad smile, replies that she recently went through a divorce, but she has a daughter, Emma. The woman admits she is tired of fighting. She faces another surgery and a round of chemotherapy. But is it worth it? Maybe it is better simply to give up. Floria says nothing, only holds the patient's hand. During her break, Floria calls her ex-husband to wish their daughter Emma good night. The girl spends most of her time with her father because her mother works so much. Floria runs up to Dr. Strobel and says that Robert is waiting for her. The doctor has already reviewed his test results. The man has colon cancer, and decides to speak with him tomorrow. Floria says that Robert has been waiting all day and that people should not be treated this way. But Dr. Strobel has spent the entire day in the operating room without food or rest and simply wants to go home. Herr Song has just had his appendix removed. The surgery was successful. Amelie is monitoring his condition. Robert approaches Floria again and asks how much longer he must wait for the doctor, as it is already so late. The nurse replies regretfully that the doctor will be able to come only tomorrow. Frau Kuhn has gotten dirty during dinner. Floria scolds Amelie for not helping the elderly woman eat when she should have. Amelie is too inexperienced and does not understand how anyone can manage everything. B. Schmidt asks Floria, who already has more work than she can handle, to assist her with one of the patients. She quickly does what is needed, then rushes back to her duties, signing medications for the patients. Suddenly the nurse notices that Frau Frey, a patient with breathing problems, is stepping out onto the balcony to smoke. Smoking is forbidden here, especially next to an oxygen tank. Floria demands that Frau Frey hand over her cigarettes and lighter immediately, otherwise security will intervene. Frau Frey, not sparing insults toward the nurse, is nevertheless forced to put her oxygen mask back on and return to her room. Herr Schneider's daughter tells Floria that Robert has disappeared from his room. On his bed, they find a note, thanking the nurse. Floria rushes off to search for the patient but he is nowhere to be found. Herr Song begins to show signs of an allergic reaction to the medication. Floria calls the doctor, and wasting no time goes to get the antidote, after which the doctor administers the drug. After some time the symptoms should subside. Floria realizes that it is her fault, because she confused the painkillers. The doctor reassures the nurse, saying that nothing terrible has happened. Herr Song will be alright. Herr Severin begins loudly complaining again, demanding that Floria bring him tea immediately, since the younger nurse did not do it. The man intends to file a complaint, not understanding what private insurance is for if patients' needs are not met promptly. Later, B asks Floria why Amelie is crying. Before Floria can answer, Frau Bilgen goes into respiratory arrest. Her son begs the nurse to do something. The woman presses the alarm button and begins resuscitation. The 69-year-old woman has cancer. Her condition is extremely serious. The resuscitation team arrives quickly. Floria assures Herr Bilgen that they are doing everything they can. But unfortunately the woman could not be saved. When the doctor gives Frau Bilgen's sons the news, they begin to cry and accuse the medical staff. The doctor patiently explains that the patient was gravely ill, her prognosis was extremely poor. Floria is terribly sorry. Despite the hardships of the profession, she is deeply affected by the death of every patient. Helping people is Floria's calling, especially the elderly who are the most helpless and often unwanted. Today is a difficult shift. B takes some of the patients upon herself just so Floria can rest at least a little. She steps out onto the balcony and starts to cry. But she quickly pulls herself together and brings Herr Severin his tea. He makes a sarcastic joke that this is a record, only an hour has passed. Unable to hold back, Floria grabs his expensive watch and throws it out the window. The man insults her, demanding that she return his 40,000 franc watch, but the nurse does not care. When Floria tells her colleague about this, B starts laughing, saying how cool it is. B volunteers to keep an eye on everything while Floria goes to look for the watch. She does not even pay attention to Frau Frey, who despite the ban, has removed her oxygen mask and gone downstairs to smoke. Floria frantically searches for the watch in the grass, but it is nowhere to be found. The nurse is forced to leave empty-handed, not knowing that the watch has been picked up by Frau Frei. Floria realizes that she is on the hook for 40,000 francs and goes to Herr Severin's room to tell him this. Of course Floria will report it to the management tomorrow, and a procedure against her will begin. To cover the damage, Floria with a nurse's salary would have to work for many years. To her surprise, Herr Severin says that he no longer needs the watch. Why would he if pancreatic cancer, his diagnosis, is one of the deadliest forms of the disease? The man cannot hold back his tears, unable to understand why this has happened to him. He has a family, money, plans for the future, he has everything, but the terminal illness has taken it all away at once. His wife does not even know about it yet. Floria puts her hand on his shoulder, silently offering support. He behaved rudely only because all the injustice of life has fallen on him. Herr Severin says that if Floria finds the watch, she may keep it for herself. Before she leaves the room, he thanks her for everything. The woman helps transfer Frau Bilgen's body to the morgue. It is not uncommon for shifts to include the death of a patient. After this, Floria checks on Herr Nana, who asks whether she will be here tomorrow. The care the patients receive from her seems to heal them. Herr Song's allergy symptoms have already passed. At the end of the shift, after making sure all the patients are fine, Floria tells Amelie that she did well. Before going home, the nurse writes notes in the patient's charts, whom among the relatives to contact and other details. Frau Frei returns the watch to Floria. The nurse in turn gives the woman back her pack of cigarettes. While Herr Severin sleeps, Floria leaves the watch in his room. She does not need the money. Any life saved is worth more than any wealth. Sadly, not all patients can be saved, but if Floria can do anything to ease people's suffering, she will do it without hesitation. In the final scene, we see Floria returning home after yet another shift. Then a voiceover tells us that, according to statistics, 36% of nurses quit within the first 4 years. The shortage of nurses is a global healthcare crisis worldwide. Don't forget to subscribe to our channel not to miss more exciting new products. Also, the authors will be pleased if you leave your opinion in the comments.